Seven, 6, 5, 4, 3, 2, 1.
Welcome everyone to CBD Talk Podcast, and today we are speaking with Terry Phillips, who has something to tell us about Harry. She was using CBD products to help her beautiful little Harry, and we're just really excited for her to share some information with us. So can we meet Harry first?
Yes, absolutely. This is little Harry. He's 14 years old.
Oh my God, he's a doll.
He's a very, very sweet little guy.
Hey, Harry. So why don't you let us know a little bit about what Harry was going through before the CBD?
Absolutely. I adopted Harry 2 years ago. He was a rescue, and so he's a senior. So he's had arthritis and he had some muscular, I'm not sure if it was a nerve issue, but he had some kind of muscle spasticity. So in May, I started him on CBD oil because I was told that was actually good for those kind of issues. And it actually helped him tremendously with his arthritis, and the muscle spasms stopped immediately. And it was really just a miracle. And before, I'm a dog rescuer, and I have several dogs, and I've had many dogs in my lifetime. I've always given them anti-inflammatories or a painkiller like tramadol, and that's hard on their bodies. Tramadol makes them kind of zone out, and Rimadyl is hard on their liver. But to see Harry do so well on something that's so harmless has been really remarkable. And CBD began to have a bigger impact on our lives when Harry was diagnosed recently with hemangiosarcoma, which is a terminal cancer. And at 14 years old, it's very, very upsetting, and the treatment options are limited. But Harry has gone from what my vets were suggesting to euthanize him 3 months ago. They were all saying that he couldn't be kept comfortable. But by increasing his CBD dose, we're almost 4 months past diagnosis, and he's very, very comfortable. And he's eating, sleeping, barking, and cuddling. It's really been a game changer for us.
Oh, that's wonderful. It's so sad when we see our pets in pain and discomfort, and getting a diagnosis like that must have been absolutely heartbreaking. But it's really nice to know that it's helping give him continuous quality of life and keeping him comfortable and happy with you.
Oh, absolutely. Yeah. And for me, it's really important to talk about because the traditional vets won't bring it up, and you really have to be your own patient advocate and do the research. Like I did. I had little to no exposure to cannabis prior to Harry's diagnosis. And it's been just a game changer for me as well, because it's impacted my life and my issues with arthritis. And my mom now takes it for her rheumatoid and osteoarthritis. So I'm really, really happy to talk about it and to share my knowledge. I'm sorry, that's Mabel.
Well, you can bring Mabel up too.
Mabel is a very chubby bulldog. I
Might hurt your back. Okay, gotcha.
But yeah, it's something that we have to talk about because the vets won't.
Right.
And the animals suffer as a result. So.
Exactly. And so how did you find out about using CBD?
Just research, just reading. And, we hear from other people that are familiar with cannabis that have been using it either medicinally or recreationally for a long time, and about the benefits. But I saw a short clip on Facebook just talking about how cannabis oil has changed the lives of dogs that have had cancer, less serious cancers than Harry, but some that are more serious as well. But just tremendous comeback stories. So I was very encouraged, and I'm a pharmaceutical rep myself, so I was researching like pharmaceutically, looking at the side effect profiles and looking at adverse events, and there virtually are none.
Yeah.
Sleepiness and everything that I hoped it would be, it has done for Harry. So I'm really, really happy.
That's one of the things that is important is, I had looked at the SAEs for cannabis, and they had last March, at the National Institute of Health had a neuroscience summit on cannabis, and one of the questions that people in around the world, anyone who was watching it was able to post questions on Twitter for
Yeah.
it. And they did choose one of mine to answer, and that was, comparing the SAEs, the serious adverse effects of cannabis to that of opiates. What comparison can you draw? And I said, well, we can't compare it because there are no serious adverse effects compared to opiates. It's, and the double-blind studies and everything is like, the most serious you get is a little anxiety if you take too much, or sleepy. So
He just gets more calm. That's all,
yeah.
really. Yeah.
So after he was diagnosed,
Yes.
before you started increasing his dosage,
Yes.
were there certain symptoms that you could say that he had this before I increased it, and then this went away with this?
Yes, absolutely. Actually, I had no suspicion that Harry was sick at all. Even at 14 years old, active, very hungry, very affectionate, just a fun, very active dog. Little dogs tend to be that way. He's my first little dog, but I never knew how they could stay so young, so long into life. So for Harry, he was throwing up and having all these just gastro issues for 3 days. That brought me to the vet, and they couldn't really determine what the issue was. So I had to actually take him to the ER. They just thought it might have been just a GI upset or a GI disorder, inflammatory bowel disease or something similar to that. And going to the ER, when they did further diagnostics, that's when we did an ultrasound, and they were able to see a very large mass in his abdomen. But because of his age, it's inoperable. And it's a procedure anyway, because hemangiosarcomas, they can bleed out very easily, and his mass seems to be very cavitated, so it would be easy to disturb something to make him, he could pass away on the table. So the CBD was really my only option for me that I saw as viable. I didn't want to put him to sleep because Harry wants to live.
Yeah.
Harry wants to be affectionate. He barks, he wags his tail, and my thing is that if he has quality of life and he wants to live, my job to make sure that I can, do that for him. So that's how we came to the diagnosis of hemangiosarcoma. And as soon as we increased his dosage of CBD, no problems. He's not thrown up. He's been very comfortable. Now, when I tried chemo, I did try traditional chemos. Problems came back. He wasn't able to eat. He was GI upset again. And that's when I just decided I was going to just stay with the CBD route for him.
Mm-hmm.
He does prednisone also concomitantly with the CBD, just also help with inflammation. And Harry's quite comfortable and he's content. Now, the tumor hasn't shrunk, and it's actually grown very slowly, but as long as he's comfortable and able to walk, I feel very comfortable with him just continuing to live as he is. And he's a happy boy.
Well, that's what's important.
Yes.
The happy boy. Yeah. So, excuse me. Have you tried it with any of your other pets?
Oh, yes. I have 2 other dogs. Monkey, who's a 85-pound pit bull, and I have a puppy mill rescue. She's an English bulldog. That's Mabel, who you hear in the background. She's also a 55. They're both chunky, meaty girls, and they both take CBD, only CBD. They don't take any other medications for arthritis and joint degeneration, and they're doing fabulously. Yes, it's, and I'm taking it myself as well. So we all can be testimonials to this product.
That's great. That's great. And that's what's so awesome, is that it is something that you can use yourself and that you can use with your pets. It is very safe. And time after time again, story after story, we hear how wonderful it works for people. So, and now we're starting to get the stories about how wonderfully it works for animals as well.
And it's nice, Don, and I'm sorry to interrupt. It's nice that I'm using vet CBD, so it's created by a vet, and the vet has experience with it. That makes me feel more comfortable also. So I'm not just trying out something that I found at a dispensary that someone just told me about. I actually feel very good about, and Dr. Shu, who's the founder of the company, he's been very wonderful in communicating with me too. Mm-hmm. And you can't get that with traditional vets.
Exactly. And see, that's the thing, is that, we're really trying to push them to go into other states, because you're blessed. You're in California. You have access to it. There's a lot of people who would love to be in your shoes right now. So So yeah, I know that. So your current vet that's caring for Harry,
Yes.
knows that he is taking CBD.
Yes, he does. Mm-hmm.
And he is seeing that it is keeping him comfortable, at least.
He actually said that this is remarkable. He never anticipated Harry to be alive a week, let alone almost 4 months now, and to be doing as well. He actually says he is a remarkable patient. And every time I bring him in, he says the same thing, and he brings the staff and he said, look at this dog. He's still here and he's still happy.
Yeah.
So he knew nothing about it, though. I have to say, this is something I had to do on my own.
And the great thing about that is that maybe perhaps, hopefully, he might be able to share that information with someone else.
Yes.
In the same,
yes.
Yeah. Well, I really appreciate you talking with us and telling us about that. That CBD is really making a difference in the lives of so many pets. And we hope to see them grow outside of California so that the rest of the world can have the same stories and benefits that you're getting. And I love how they work with the dosing, to help people with the size of their pet, because that is, it does help to have that guidance to be able to say, oh, he weighs 20 pounds. This is how much I should give him, instead of trying to figure it out on yourself. And they are there to support you. So.
Yes, and Dr. Shu is the one who actually had me increase his dosage from once a day to twice a day once he was diagnosed with hemangiosarcoma. He did suggest that for Harry, and it's just been, that CBD's been a godsend. I'm really, really happy about it. So.
Oh, that is awesome. Well, again, thank you so much for sharing your story, and continued success with all of your pets with the product, and share the CBD love. Everybody, go research it for yourself. Find out what works for you. If you're in California, Vet CBD is available. If not, hopefully they'll be coming close to you. But do your research, find out what you can use, and help your pets. It makes a difference, and they deserve to have the access to it just as much as you do. So thanks so much, everyone, and we'll see you soon.
7, 6, 5, 4, 3, 2, 1.
Thanks again for listening, and be sure to tune in again next Wednesday at cbdtalkpodcast.com. Until then, stay happy and stay healthy.